Infections by multi-drug resistant organisms are increasing worldwide and occur in healthcare settings via contaminated hands, equipment, and environment. Hand hygiene is an important factor for prevention of infection in hospital settings, especially the intensive care unit.
So how do we go about this? This is just going to be a routine practice for us every single day. Let's not be lethargic about not keeping our hands clean before touching the next patient. Hand hygiene is so very important to be practiced as your part of routine every single day.
Hand washing is one of the most important aspects of daily hygiene. If it is practiced every day at home, especially in the hospital, before and after touching a patient, and before we enter the surgical room, almost 50% reduction in infections and problems after the surgery can happen.
Regular hand washing with soap and water or using alcohol-based solutions will help to remove germs including bacteria and viruses.
It prevents cross-transmission of microorganisms from one person to another. Thereby, it helps prevent hospital-acquired infections. It limits occupational exposure of these microorganisms.
Studies have shown that hand hygiene is the single most effective intervention to prevent infections in this population.
May 5th is celebrated as World Hand Hygiene Day, and hand hygiene is the single most effective indicator in reducing hospital-acquired infections.
According to the World Bank, hygiene promotion is the most cost-effective health action to reduce disease.
Among hemato-oncology patients, the risk of life-threatening infections is obviously quite high. This is both due to their underlying disease as well as the immunocompromised due to the treatment which we give. Among all the interventions, the one which has really stood the test of time as the single intervention which can lead to saving of lives is the 6-point hand hygiene technique.
Since we all know that wound infections are our biggest worries as surgeons, hand hygiene becomes a very important part of what we need to take care and maintain so that we don't spread infections.
So I understand it is my duty as a senior to escalate the same kind of education to the last nurse who is taking care of the patient, because even what she does, a small mistake of not washing the hand and contaminating whatever line, never mind what she is doing with the patient, she can, it's going to create a long stay of a patient, unhappiness, lot of financial burden to a patient. We have no right to do it.
We always ensure proper hand hygiene across the hospital for patient safety and well-being.
Hand hygiene is very effective way to keep people safe from infection, and also it saves their lives.
Usually newborns are prone for infection with bacterial, viral, fungal due to lack of adequate immunity to fight against these organisms.
As surgeons, we are touching patients every day, and our surgeries involve utmost aseptic precautions.
Hand hygiene practices are of paramount importance in reducing the cross transmission of microorganisms, hospital-acquired infections, and the risk of occupational exposure to infectious disease.
As we all know, infections are the major killers of mankind, and hospital-associated infections cause a significant morbidity, mortality, and increase in healthcare costs. Infection control practices need to be practiced by each and every healthcare worker to prevent infections, prevent our patients from getting infection from outside, and to prevent cross-infections between our patients. Hand hygiene is the most cost-effective, simple, and pragmatic infection control measures to be practiced all the times.
So first of all, there are two things involved in hand hygiene: when you do it and how you do it. So about how you do it, there are about 6 steps that you'll have to learn about doing it. So doing them for about 60 to 90 seconds is good enough. That is for a routine hand wash. And for a surgical hand wash, we require it to be done for about a minute or two and repeat it for about 2 to 3 times with either a betadine based or a chlorhexidine based disinfectant.
Clean hands save lives.
Zero tolerance to infections.
I pledge to hand hygiene.